everyone, I'm Scarlet from Lost Wellness, and we want to welcome you back to our Better Together series. Today I'm here with Audrey from OrthoLazer, and we're so excited to bring you another wonderful episode on hip pain as well as SI joint pain. I think one of my favorites, Audrey, because it's something that is very common amongst both our patients,
Yes,
right? We see it
absolutely.
often. I work with a lot of patients where their lower back is always bothering them. And I'm sure you guys see that,
Yes,
with your patients as well.
absolutely. A lot of lower back pain that's stemming from SI and tight hips, and people just don't realize it's their hips that are really causing the problem. So,
Yeah, and so today, like anything that we do is helping you get to the root cause of what is the actual challenge or issue. And so when we talk about the hip and the SI joint, which is the sacroiliac joint, we're talking about, it could be like I always say, like, okay, if it's one side that's hurting me, it could be the other side because everything is connected, right? Compensating.
Exactly.
So that's exactly what happens with the hip and the SI joint. They're actually forming as the foundation to our spine. So it doesn't necessarily mean that we truly have, we want to always validate that yes, you have pain, but what we're trying to say is that not all the time is going to be that direct pain. It could be an indirect pain that's coming from a stiff hip and also
Pulling those muscles forward and
Exactly.
tightening and up. Yep.
and also like that little bit of lubrication coming to that SI joint because the sacroiliac joint is a joint, right? So today what we are preparing for you guys is 3 exercises that you can do at home, but I encourage you to come visit us to create a personalized plan that's unique to our patients, but in combination to MLS laser therapy as well. So before we get to the nitty-gritty of the exercises, which is always a favorite to help someone improve their mobility, decrease that stiffness on their hip, that will essentially allow to have your lower back relax or also like not have that extra load. So think about the back as if it's like taking all that load, right? We want to remove that load by loading properly the other parts of our hip area, which is the numerous muscles but also joints. So what we're gonna do today is 3 exercises that will definitely help to open the SI joint, loosen tight, hip muscles, even the glute area, as well as helping release tension in those hip flexors like the psoas major, which is another muscle that we talk about all the time and we work on our patients very frequently. And these exercises also will help reduce strain on that lower back, which is why we're really here, right? So I'm excited to show you these 3 movements, and Audrey's going to help us demonstrate. So we're going to start off with the first one, and that one is our hip flexor to hamstring. So you're gonna be facing this way. Yeah, there we go. So one knee down, almost like, yeah, there we go. And so what she's going to do is she's gonna push forward. Yes. So this is almost, here is the key to this one. On this position where she pushes forward, she's gonna start feeling that stretch on this side. So it's almost like a hip flexor. That's why it's called a hip flexor movement, but it is really helping that psoas major, opening it up. And then what she will do is coming back, bringing that leg all the way. So that is going to start stretching the posterior part, which is on the back, the hamstring muscle. That also helps release and stretches that glute as well, hamstring, and also gives that hip flexor a little bit of just really not a lot of like loading. How does that feel? Tight, right?
I'm gonna switch legs just to show.
Yeah, absolutely.
That's
So we ideally want to do this too.
balance thing is really nice.
Yeah, no, take your time as you switch, right? If you're feeling lightheaded, you're losing that balance, just take a moment and reset fully. we're not racing right through these movements. We want to make sure that we do the full range of motion. And this is another way to actually do it too, so that you can feel that full stretch. If the first position isn't allowing for that full hamstring pull. All right, so you do want to feel that pull in that hamstring, so you know that it is stretching and working. Beautiful. Thank you, Audrey. Our second one is that 90-90 hip stretch, which is one of my favorites, to be honest. So when you're in that 90-90, one leg forward and one leg to the side, just like this, you want to push back. So this is the leg that's going to feel that pull.
This way?
Yeah. So you're almost trying to sit down into it.
Yeah. Gotcha.
And that's where you're going to feel that. And then you change
I know that you're doing it right. Well, you
feel it. Same thing, 2 rounds, about 8 per side. And you can always adjust because our femurs, our anatomy and physiology is so different. So if for you this position feels like, oh, I'm not feeling it, you can always adjust, taking this out, maybe wherever you feel, as long as the concept is of trying to sit back into that full sit. All right, awesome. I love it. So the last one, this one adds a little bit of load into the equation, and you can start without the weight and then increasing. It's up to you, but for this video with Audrey, I want her to use some weight, because again, this is a great example of coming for those individualized sessions with Moss Wellness, because we grow, right? We graduate into using some weight that's then allowed to build strength, not only lengthen the muscle. We want to do the strengthening part as well. So she's gonna get on a knee. And on this opposite leg is the toes facing out, and she's going to gravitate and pull. Very good. That opens that hip flexor muscles and hip, feeling that pull. Beautiful. Nice. And we want to do this 2 rounds, 8 per leg as well. And you can always use something to protect your knee if it hurts. How did you feel with those on?
Amazing. Yeah. My hips have been dying for so I'm very excited about it.
It's funny that you say that, but I love that, Audrey, we've been working together on these exercises, and one of the things that I love about you is that you really listen to your body. Really and truly, you're really the author of this, because you have to listen to your body.
Oh, it speaks.
Right? Yeah. Without you, then our job is impossible. So we just want to encourage you to listen to your body, even if it's something minimal to something extreme. We want to know about it. We want to know your story so that we can be a part of it to help you achieve wonderful mobility and success for your long-term health. There you have it, guys. 3 wonderful exercises that you can do at home or with us in combination of our therapies, from mobility work and stretching and strengthening as well to MLS therapy, a combination that just works wonderful together. One definitely complements the other. And today we just want to invite you to come in and visit us for a personalized session, because even if you're experiencing lower back, or it could be you, me, anyone, the treatment is different. SI joint and hip pain is very common, but very treatable. So there is a planned treatment to help you mobilize your body and improve the way you walk, the way you wake up and get out of bed, to the way you run with your kids, your grandchildren, you name it. There is a solution, and we strive to help you get to that root cause and create a plan that fits and meets you where you are. So see you soon on our next Better Together series.